first thing, can I be here?
Yeah. You just don't want me to get your head right.
Do you know when to Zoom?
Tell me when to Zoom.
I'll tell you.
Okay, so the night nurse has said that Mr. Smith is due for a bolus feeding at 10 a.m. So the first thing you're going to do is check the MAR against the physician's orders. And then when you look at the MAR, you notice it's 9 a.m. It's due at 9 a.m. and he also needs his medications at that time. So you're going to look at the medications, you're going to check and make sure that they can be crushed or they can be in liquid form, and you're also going to see what type of assessment is needed. Ideally, you would assess your patient to make sure that the medications are safe to give, and you're also going to assess your patient to make sure that they're tolerating the formula okay. And I'd want you to let me know what kind of things you would see if they weren't tolerating it. Then you're going to check your MAR against the physician's orders. So you're going to, remember, you want to look at the patient name, you want to look at the patient birth date, you want to look at the medications and the formula order on the MAR, and you're going to make sure that the physician, that is exactly what the physician wrote, and it matches perfectly. Okay, so we've done our first check, we've checked our MAR against the physician orders, then I'm ready to get my medicines ready. So I'm going to get this patient's on XYZ medicine and ABC medicine. So I'm going to crush I made sure that they can be crushed. I'm going to crush those medicines. I'm going to put them in a plastic cup. I'm going to label the cup with a Sharpie. I'm going to put the drug and the dosage, but I'm going to wait to mix the water till I get in the room. And I also need my can of formula. The doctor ordered Jevity, 1 can every 4 hours. I have Jevity. I'm going to check the expiration date. It's not expired, and I have the correct type of Jevity. Then I'm going to go into the room. I'm going to need my formula. I'm going to need my irrigation bottle with my catheter tip syringe. I'm going to need my medicine. I'm going to need 12 hands. I'm going to need my MAR. I'm going to need something to protect the patient clothing. Okay, so then I'm going to go into the patient room, and I'm going to clean off the bedside table. I might need to clean it with soap and water or an antibacterial equipment cleaner that might be available in the restroom. And I'm going to set my stuff down. I'm going to set some paper towels out. And I'm going to set everything on there. This is my clothing protector for the patient. I'm going to have my medicines. I'm going to have my formula. Well, I think I'll give the medicines first and then the formula. So the first thing I'm going to do is add water. I've measured my water. I've gotten water either from the sink in the patient's room, or I could have brought a cup of water in from the kitchen to dump in there, because I don't like bathroom water, but that's just me. Then I'm going to take water, and it should be kind of room temperature, or ideally even a little warmer, to mix with the medicines, and I'm going to mix 20 to 30 mils of medicine, of water with the medicine, and I'm going to stir it up with a tongue blade. And then I'm going to let that sit while I'm checking placement and checking patency so that the medicine has time to dissolve. Okay, then I'm ready. I'm going to go into my patient's room. Hi, Mr. Smith. I'm Lori with Glendale Community College. I'm a student nurse, and your nurse has asked me to give you your tube feeding today. Would that be okay? Okay. Have you been feeling all right? Have you had any nausea or vomiting? Any diarrhea? When did your bowels last move? And it was normal, soft, brown bowel movement? No problem. You're not loose? Okay, very good. I'm just going to take a look at your abdomen, and you could have done this before you even came in the room before. I'm just going to take a look, and you're going to assess that there's no abdominal distension. You're going to assess that the patient has bowel sounds. Okay, First I need to check and make sure the tube's in the right place. So pretend I have a stethoscope. Okay. Do I have to have a set? I don't want her taking a picture of me.
No, I won't.
Oh.
Mm.
Around her neck. You can take a picture of. Okay. Okay, where are you going to listen? Left upper quadrant, right? So I'm going to, before I uncap the tube, I'm going to make sure and pinch it. And then I'm going to hook up the syringe, and when I hook up the syringe, I'm going to push it in and give it an extra little twist. Then I'm going to put the stethoscope, and if they have a G-tube, obviously you put it right by the G-tube because that's where the stomach is. Then I'm going to push it in fairly quickly, and I'm going to listen for a whoosh. So I heard the whoosh. Then I'm going to pull back, and if there's pH paper available, I'm going to check the pH. The pH should be under 4 unless the patient is on an antacid type pill like a proton pump inhibitor or a H2 blocker like Pepcid, Zantac, Prevacid, all of those. What's the purple pill? The Nexium. So I'm going to check, and the pH is less than 4, so I'm okay. Then I'm going to hook the syringe back up, and I'm going to check for residual. I would, of course, be wearing gloves, and I washed my hands before I did this. And I checked, I screwed it all up. I have to start over.
Okay.
I didn't check ID, I didn't do it. You guys should have yelled! I was doing the